right, we are live.
All right.
Good evening, everyone. Thank you for tuning in to the health show this evening. Today, we are going to talk about travel opportunities for health professionals. Thank you for staying tuned. Thank you for coming in. If you are just here and you've not subscribed, I would like you to click the subscribe button right now so that you can have updates of our subsequent events and videos. So we have here on the show Mr. Robert and Augustine. I usually call him Augustino. All right. So I want them to introduce themselves for everyone who is watching. Mr. Robert.
All right. Good evening, everyone. Robert Abachi. I'm a socioeconomic analyst.
Okay. Augustine. Augustine, Mr. Augustine, or Augustino. Wow. So I guess maybe his network is having some difficulty connecting. I really hope it fixes that soon. All right. Now we just have. Let's talk about the recent trends that happened recently. You know, many places claim insecurity is the reason why people travel abroad and they abandon all their belongings and all their belongings and it's kind of related. All they abandon all their belongings and try to create a new life abroad. So I don't know. Do you think security is actually the issue or the major reason why health professionals are going abroad, or what? What do you say, Mr. Robert?
Okay. I think one of the major issues is the way the government takes health.
Okay. Sorry, Mr. Robert. Let's put a hold on that question. We'll come back to it later. So, Augustine, can you please introduce yourself?
Okay, good evening, everyone. I am Pharmacist Austin Odibo. Thank you for having me.
Okay. So, Augustine, can you please talk to us now? We try to make the show related to mental health. You understand? Because anything that makes us make a decision about where to settle, where to relocate to, has to do with our mental health. That's the fact. You know, most of the decision we take either to relieve stress, to seek comfort, or whatever that has to do with relocation or well-being, general well-being is related to mental health. So what do you think, Mr. Augustine? What do you think are the travel opportunities for health professionals, especially those that are watching the show right now? Do you think it is actually greener on the other side, or it's just a tale by moonlight, what we usually hear?
Okay, can you hear me?
Yes, I can hear you.
Can you hear me?
Yes, I can hear you.
Can you hear me? All right, okay. Your question was if it's green. Yeah, I get you. Your question was if it's greener on the other side for health professionals. I think basically in life, everything depends on what you want for yourself and what your plans and goals are. Some persons actually will make it very well here in Nigeria, while others will make it abroad and all that. But for me, I think it is greener on the other side because there are a lot of opportunities and there are values to your hard work over there. You don't just work without commensurate benefits per se. So basically, I think it is, but like we all know, life generally have its twists and turns. So it will not always be easy at first, but I believe it requires patience and forbearance and planning to make wherever you are beneficial to you. And also, there's also a place for the God factor in everything. So there are some persons that make it so well in Nigeria, while there are other persons that once they just break the inertia of leaving the country, they actually will be better off than they were in Nigeria. So it depends. It depends. There's no size fits all. It depends on your personality. It depends on what you want. It depends on your plans, your goals and aspirations. So that's it basically. And also, before making plans to move and relocate, you also have to check out the economic status in that place, wherever you choose to go to. There's no perfect place per se, but what we basically look for is a perfect economy, perfect working system. So that's just my take for that.
Okay,
Thank
before we
you.
really go, yeah, before we really go into details of how to make all these journeys, what do you think is the real reason why health professionals actually leave the country?
That's a very tricky question because everybody, nobody went to pharmacy or medical school for free, and nobody went there just to be a gazer per se. So people leave because of the benefits. There's something called the humanistic benefit of travels and all that, the economical benefits, the outcome. So basically, I think the driving force is the economic benefit and the job satisfaction you get wherever you relocate to. That's it. People get job satisfaction as their reason of living or relocating. So everything boils down to self-actualization. What you really want. Oh, this one will be good for me. I want I want to make more money. I want to live good life. I want to prepare a good future for my children and all that. So you have to put yourself on the line and take the risk to relocate. So that's basically why, in my own.
Okay, I think we lost Dr. Augustine there. Mr. Robert, are you on?
Yes, I am.
Okay. Back to the questions we were asked. I think it's in relation to the response that he was trying to give. So, what do you think? Many persons blame security on the reason why health professionals leave the country. So, what do you think is the real reason?
Okay. There are many reasons involved. Aside, even though we like to think it's just the personal finance, but then there are many reasons why people, doctors, pharmacists, nurses are relocating. We have the working condition itself,
Yes.
where people who want to make impact, because many of these healthcare professionals became healthcare professionals because they wanted to do good, majority, not really because of finances. But then they come into the system and they get frustrated because they are not even given the equipment, the services required to provide that good. And then they get frustrated, they get tired of having to have all these negative outcomes that could be easily averted if the ready environment is there. So all these things come together with also the personal finance, which is the last level of it all, to just make people feel they've had enough and they have to leave to quote unquote greener pastures.
Okay, and now we just have the recent issues of the Deborah's case
Yeah.
currently going on. Do you think that that is likely enough reason for a health professional to leave? Because we've had a lot of rumble on our professional WhatsApp group, and people are saying it is unsafe to be a pharmacist, unsafe to be a doctor. Do you think that is enough motivation for people to just decide to leave because of insecurity? We have other professionals that are still in the country. When they hear
Yes.
such news, they seem unbothered. For example, they have the engineers, they have the lawyers, but the health professionals are much more concerned about security. Do you think that is a well-placed concern, or is just overblown or exaggerated?
Yeah, it depends on different circumstance. There are some people who feel, yes, I'll take that risk because if the worst scenario happens, which is death, my family and my loved ones will be taken care of by the government, which we see in some countries. But here in Nigeria, there's the natural mistrust, rightfully so, of government. So people may feel, even if I take this risk, even if I want to save lives, if something happens to me, there's nothing for my loved ones to fall back to. So they just feel it's best they just leave the country.
Okay, okay. So it's all right. It's all right. Means it therefore means that those blaming it on security, they actually have a well-placed what do you call it? They have a genuine reason to actually put it on security for them to relocate to another country.
Yes.
It's okay. Our main speaker is not around. I think we just have to have an all-round discussion about people traveling, so that we'll be able
Yeah.
to wrap up this topic. Maybe subsequently we can get him on board and put a wrap up on the topic. Well, apart from these courses that we have discussed, apart from these
Yes.
courses, what
Yes.
other causes do you think can be the reason why people leave the country, especially Nigeria?
Okay. The general government attitude towards healthcare is
Okay,
fundamentally what causes all these things. For instance, World Health Organization recommends that at least 15% of a country's budget should be spent on healthcare.
okay,
But that is not the reality in Nigeria. And that money, if you look at it, what would that money be used for? It's still going to be used for equipment, to improve service, to pay medical professionals. So you can see that the nucleus of all these issues that we've mentioned earlier is still down to the government's attitude towards healthcare.
okay,
And then you see the repercussions of this. There's this World Health report, I think in 2018, that was released, that shows that the ratio of doctors to patients in Nigeria is 4 to 10,000, which is
wow,
insane. Yes, the ratio of beds to patients is 5 to 10,000.
wow,
So if you are a medical personnel and you hear these things and you experience these things, you see people die for things that could be averted over a period of time. It gets to you, really, and you just feel it's best to just go to somewhere where you can function properly.
okay. Now, what do you think is the solution? We have analyzed a few of the problems. Now, what do you think is actually the solution of this medical professional, exporting this medical professional? What do you think is it going to be a concrete solution that the government can take place can affect?
They just have to take it more serious. They just have to take the sector and many other sectors, but since this is the sector we're speaking on today, they just have to
Okay,
take it more seriously. They have to invest in healthcare because it's a no-brainer because health is wealth, like they say. You cannot be talking about oil or agriculture if people are not getting the best healthcare they can. And we can see what is happening with medical tourism. Even though our president came on the promise that he will end medical tourism, ended up being the poster child of medical tourism. But if the government takes it seriously and puts the adequate fund for it, there are people who want to stay, like the speaker rightly mentioned. There are people who love to stay and serve, but because they don't have this enabling environment, they go. But if the government can pump in the money right and use it well, it will reduce this medical migration.
it's all right. Thank you very much. Let's move on to our speaker. I think he's online. Austin, can you hear me? Hello, Augustine. From Augustine, can you hear me? Well, I guess his network is quite poor. Okay. Now, um, we'll just have to do a little wrap up here. But subsequently, I guess maybe he'll have to send his videos recorded, pre-recorded, so I can put in for the viewers to go through. So that those of them who had come expecting to meet this content, I can easily redirect them to how they can get the content. All right. So let me just throw a few comments about um, medical exports. See, it's actually a major problem in the health sector because we train doctors from year one to final year, and then nurses and pharmacists, and they end up spending just 1 or 2 years in the country because they all want to leave. And the federal government had made several moves in the past, and most of those moves have been counterproductive. And some of them have been reaching to the United Nations, stopping doctors from leaving. Some others are reaching directly to UK, to the UK Doctor Association, and to prevent Nigerians from coming there. So that's not how to keep your citizens in the country. If you treat them well, many times the doctors go on strike. Well, I can count the number of times when the doctors go on strike. It's not supposed to happen in a sane society. Those things they are they are not mentioned. In the past 10 years, I can't remember when the doctors in the UK has gone on strike. So I think if the major needs of the doctors and the health professionals are met, then we will not have the problem of doctors deciding, or after spending 8 to 9 years, some of them 10 years in school, are trying to write series of exams which will actually take them another 4 to 5 years to complete. You understand? After 7 to 8 years of training, they are supposed to start working, start getting more money. But many of them put in more efforts to write these exams outside the country so that they can practice there. They don't care the time. They don't bother about time because they feel it is their life and it is their future they're trying to fight for. So if the country is doing them well, yes, maybe they'll consider staying at least sad for some time. And I don't know if you hear the news, Mr. Robert, where the government were trying to, or have been trying to make it compulsory for a health professional to serve the country before he leaves, like something like that. I think the last time I heard was the Minister for Health said something like that, and it was suggesting 4 years. It's in a medical professional, you have to work for 4 years in the country before you can leave, something like that. So that's not how to keep your doctors. That's not how to keep your health professional, because they will leave one way or the other. You understand? There are stories of doctors leaving the country to go practice something else outside the country. Maybe become a what they call a sales attendant, become a sales rep, become customer service, just because they want to leave the country, and this is very bad. You understand? So I think if most of the needs are met, we'll have less of this happening. We'll have less of this happening. Before we go, I don't know, Mr. Robert, do you have any exact problem you think the government can solve that will make our health professionals stay?
Okay, I think they could start from the public health sector itself, because we see how abysmal these hospitals are. There are hospitals where they pursue. There was this investigation that was carried out. I've forgotten the name of the hospital, but they pursue snakes every day from different wards. This is where people are on drip, people are sick, then you just see snakes passing. It's insane, and it's not rocket science really. If the funds are provided, if the funds are not stolen by some people, then all these things sorts itself out.
So it's still boiling down to corruption.
It's still boiling down to corruption on various levels. And then the government's attitude towards the problems of the country is the problem. You've already mentioned how they are trying to stop people from traveling. There's a problem in the country. Instead of it to solve that problem, they are trying to court-martial people to remain in that problem. And from 2015 to 2021, a total of 4,528 Nigerian trained doctors have migrated to the UK. This is just one country. Just one country. I'm not talking about US. I'm talking about the Middle East.
Wow.
And this is just doctors alone, not nurses, not permanent. Yes. Just from just 2015 till now.
And from what I hear, UK is kind of the most difficult place for them to practice.
Yes, Yes.
So
So just imagine 4,000. Hello, can you hear me?
yes, I can hear you.
Okay, yeah. So this is just the reality. People don't just wake up and want to migrate. There are problems. So the government should sit down, have an honest conversation with these people. You cannot just say, okay, because people are migrating, I'm going to stop their migration. It doesn't work that way.
Now, on the side of the federal government, I just want to make an argument for them. I've listened to the Minister of Health speak, and sometimes he blamed the fact that the doctors, because he himself is a doctor, he blames on the fact that doctors are asking for extraordinary demands, like their demands are extraordinary. Like, do you ever think that the request of a doctor could be extraordinary? Like, you could be asking too much because they know the integral part they play in society and community health. So do you ever think that the doctor can be asking too much or using that position when he applies to ask too much from the federal government?
I just feel I would like to have his opinion before he joins the government because what are they asking for? Better healthcare facilities, better environment. No doctor is coming to say that the government should pay them what senators are collecting. No doctor is saying that. No doctor is saying the government should pay them half of what is, in fact, 20% of what the senators are collecting to sit down and look pretty. So if we are being honest with ourselves, anyone that says the doctors or any medical personnel is asking too much, the person is just trying to please some people at the top. That is just the reality of things.
Okay, so that's that for that. All right, so I think this is a wrap up. I'll just give a few comments before we leave. We actually sincerely apologize for our guest speaker not being around. We'll look for how to convey the information he ought to pass in this live stream to our audience. And as much as possible, we encourage you to stay tuned on the channel, subscribe, and turn on the notification because um, we will we will we are going to upload the content or the information he wants to share in this video. We're going to upload them subsequently for you. So we sincerely apologize for his absence. I think he's having strong network issue in the location where he is. So this is me saying sending my apologies and saying thank you for staying tuned with us too because that have been online and see you in our next video. So Mr. Robert can give them the last comment.
Yeah, okay. My last take on this will be even medical personnel that want to leave the country. Yeah, be
Yeah.
very sure you do your research before you start because the process is very expensive, first. And secondly, you are not, things don't work like how they work in Nigeria. If you go there, like you mentioned earlier, some people don't go as medical doctors just because they want to leave the country. If you go there with a certain job, you cannot just change to becoming a medical doctor over there. It doesn't work that way. So even though we all want to leave the country, I think we should all take that time to understand the repercussions because there will be repercussions for everything we do when we are registering and all that. So I think that is very important.
Mr. Robert, sorry, you just mentioned a very, very nice point. What do you think are the repercussions of living in country?
Okay. You are going to first of all, you are not a citizen of that country. That is the first thing. So it comes with some restrictions like working hours and all that. And if you go, let's say you leave the country as a caregiver, because that is one way that many medical personnel are leaving the country as caregivers, because it's easier. You just need to, if you have a request form from maybe an employer, you submit that, you go on the whole process, and let's just say you make it over there as a caregiver. You cannot change, even though you provide your medical license and all that, you will need to come back to Nigeria, reapply as a medical doctor.
Yeah.
Then if they give you that go, you can now go back. So first of all, there's no mobility. You have to be in that job that is on your visa till I think maybe 5 years. I'm not really sure about, but it's a minimum of 5 years. And there are a lot of things that we overlook here that you will have to take seriously over there.
So you mean majorly the repercussions refer to a change of lifestyle, change of uh, bureaucratic processes over there are quite stricter than the way they
Yes,
are in Nigeria. You know,
yes,
you can go to an office today in Nigeria and then tip your way through to the final stage all in one day. But
yeah,
over there, you will have to wait the process and
yes,
see it to the end. Well,
yes, yes,
I think there are news of some doctors getting into trouble overseas, and there's some news of some pharmacists too getting into trouble there. You know, recently I read of I think that was January this year, with pharmacists who dispensed without prescription in the UK. He's
yeah,
in Nigeria, so I just thought he thought he was in Nigeria. You understand? You can
yeah,
walk away.
yeah,
You can walk away from that here. All right.
yeah,
So the practice system is different. You understand? Nigeria, the place is all messed up. You can get anything you want. You can walk into a pharmacy and get any kind of drug, depending on the kind of on the moral standard of the pharmacist on duty. You
yes,
understand? But over there, it's not just morality we're talking about. We're talking about your license being on the line if you dispense what you are not supposed to dispense.
yeah,
So all of this all adds up, and the fact that many persons, there was a story, of a boy who could not complete his fees. I don't know if you saw that story overseas, and he was told to withdraw. Many persons go there in the guise of doing their masters, and then they just put some funds in their account and then complete their transfer over there, and
yeah,
then they abandon the school and face other things. You understand? So I don't know what happened to this particular person, but the school wrote to him that he was being withdrawn from the school because he could not complete his fees.
wow,
And they also mentioned in the letter that they were going to send this notice to I think the visa, what they call it, the embassy, so
yeah,
they can also revoke his visa. So it was that cruel. Imagine traveling, leaving a country, and after a few months you are back because you cannot complete the fees. So most of all these details you have to have them and try to ensure that you familiarize yourself with them. So most all these touching and emotional stories do not become part of your tale. So
yeah,
I think that's that for that. Whosoever who's ready to put his hand on the plow should be ready to be back. For those of us that are here, we try to ensure we enjoy the country while it lasts at least. So that's that for that. I really appreciate your presence, Mr. Roberts. Again, I apologize for our guest speaker not being online. We are going to look for how to upload all the content he's supposed to share with us on the channel so that everyone who is online right now will view and then watch and learn how to various means you can use to live the country as a health professional. So until next week or until our next video, thank you for staying tuned. See you next time.